My name is Dr. Mohit Kukreja and I'm a consultant orthopedic surgeon at Hospital, Mumbai Central. One of my interests is doing shoulder surgery, and today I'm here to give you some more information about what exactly are the emanating factors for shoulder pain and some simple home remedies to take care of it. So this is a shoulder joint model where you can see this is the arm bone, this is the shoulder blade bone, and this is the collar bone. And the shoulder joint is kept stable by about 4 rotator cuff muscles which turn into tendons and are attached to the arm bone. So this is the front tendon, which is subscapularis, one on the top, which is the supraspinatus, and 2 tendons at the back. These keep the shoulder joint stable and help it move while you elevate the arm. Commonest cause of shoulder pain, probably in most of the patients that I see, is rotator cuff tendinitis, which is inflammation of one of the tendon attachments, which leads to swelling in the bursal sac or the fluid sac under the collarbone. Apart from this, also rotator cuff tears is something that I see a lot in practice, and this is usually either after a fall, which can also happen in young patients, or due to degeneration in older patients. The other common shoulder problems are a frozen shoulder where the capsule around the shoulder becomes tight, a broken bone, which is usually after a fall or injury, shoulder dislocation. Usually patients come to me with recurrent shoulder dislocation where the shoulder joint is not stable. In terms of treatment, the good news is that most of these problems can be treated initially at home with simple remedies like applying ice on the shoulder for about 15 minutes at a time, 3 to 4 times a day, doing a good amount of physical exercises in terms of physiotherapy. So visiting a physiotherapist and doing some rehab for about 4 to 6 weeks takes care of the pain. Over-the-counter pain medication definitely helps. If these options are something that you have tried and something that you have offered your shoulder but it's still bothering you, I definitely recommend a visit to our shoulder department at Hospital, Mumbai Central for further information. Thank you.